Hello, I'm Dr. Donovan Eu. Did you know that cancer can develop in the mouth, tongue, cheek lining, gums, and the palate or the roof of the mouth? This is what we call oral cancers. Many of my patients often ask me what causes oral cancers. The exact cause of this is actually not known, as there are many patients with oral cancers despite having no significant risk factors. However, oral cancer is commonly seen in patients who smoke, drink heavily, or chew tobacco. We are, however, seeing more younger patients with the disease compared to the past. In that context, oral cancers can actually happen to anyone. Little pain can be felt in the early stages. This explains why oral cancer is commonly discovered at the later stage. Discoloration of the mouth lining or an ulcer that lasts for more than 3 weeks despite medications are telling signs of oral cancer. Therefore, please consult an ENT doctor if you are presented with such symptoms. In the later stages of oral cancers, common symptoms include persistent presence of blood in the saliva, a lump or nodule that bleeds on contact, numbness of the chin or the lower lip, pain when eating or swallowing, persistent earache, and lastly, a lump in the neck which might indicate that a cancer has spread to the lymph nodes. If the tumor in the mouth is large, it may affect breathing and speech. Patients may find it difficult to open their mouths. An ENT specialist will perform a detailed head and neck examination and a nasal endoscopy to diagnose oral cancers. A biopsy is also done to collect a small tissue sample. This will be sent to the lab to check for cancer cells. This procedure is usually done in the clinic under local anesthesia. Surgery to remove the tumor is the most effective treatment. In most cases, the tumor is removed completely. Together with surgery, patients may require radiation treatment with or without chemotherapy. What happens during the surgery depends on the extent of the cancer. If the tumor is deep to the muscles, there's a high chance that they're spread to the neck nodes. During the same surgery, a neck dissection may be required to remove the lymph nodes. If the cancer is spread to the bone, an area of the bone may have to be removed as well. After removal, the oral cavity is often reconstructed to enable patients to eat and talk normally. Patients may require a breathing tube and a feeding tube post-surgery. This is usually temporary and be removed when the wound heals about a week after surgery. Some side effects after surgery include changes in the way of speech and swallowing, which may require patients to undergo speech therapy. Mild swelling and fullness of the neck, which usually improves by itself. Massaging the wound might often help to reduce swelling. Neck stiffness can be minimized by moving the neck regularly. Men are twice as likely to develop oral cancers compared to women, with men above the age of 50 facing a higher risk. There's no definite answer as to whether a relapse could happen. However, the risk of relapse is dependent on the stage of the cancer. Patients with late-stage oral cancers have a generally higher risk of cancer relapse. In general, relapses usually occur within the first 2 to 3 years after cancer remission. Treatment for oral cancers is usually quite effective. The survival rates, even at advanced stage, are fairly high at about 60 to 70%. I hope this video has been useful. Thank you for watching.